Chapter 4, the musculoskeletal system. So with Chapter 4, we're going to combine the skeletal system and the muscular system together because they are complementary to each other, and um, we'll be looking at the major pathologies, assessments, and word parts related to both systems. So as always, the subjective word roots and word parts we're going to be learning, and those terms associated with that, the objective terms associated with the musculoskeletal system, and then assessment and plan will be in our part 2 video. So let's begin with the skeleton. So when you look at the major bones of the skeletal system, your textbook, and I believe this is page 76 of your textbook. These are just the main ones that you need to know. These are the main ones we're going to learn the word roots for. So it is definitely not an all-encompassing list. You'll learn that when you go further into an anatomy and physiology class. So this is an anterior view. This is a posterior view of the both axial and appendicular skeletons here that is articulated, meaning put together. So you have the cranium, okay, or head or skull, anterior, posterior. You have the cervical region, the cervical vertebrae, cervico meaning neck, the costal cartilage and the ribs, the costals here, anterior, posterior view, scapulas, the clavicle, your humerus, your upper arm, the bones of the lower arm, your uh, um, radius and ulna, your vertebral column here, your thoracic vertebrae, your lumbar vertebrae, your sacral vertebrae, your hips, the pelvis area, pelvic symphysis here, your femur, your carpals, metacarpals, phalanges, and then the patellar region here, anterior, posterior patella, your tibia, fibula, and of course your tarsals, metatarsals, phalanges of the feet. Okay. So you're going to be referring back to that quite frequently. So the medical term for the word root for bone is osteo. There's actually more. I think there's about 6 total: osteo. But for this introductory course, osteo, meaning bone. Okay. And then from here on out, it's what different types of, it's the different types of bones. So cranium or cranio is the skull and all of the bones of the head and skull. When you look at each individual bone that makes up the skull, they each have their own individual name. Okay, frontal bone, temporal bone, occipital bone, vomer, mandible, maxilla, all of that. But for our particular purposes, cranium, okay, the head. Anytime you hear that term neck or cervico, they mean the same thing, excuse me. So these are the bones that make up the neck of the vertebral column. Okay, there's other organs in the body that also have necks. So you may have heard of other cervical areas of the body, but that term cervico always means neck. Okay. The vertebrae, combining form and root word spondyle or spondylo, the combining form. It's Latin for turn, so it allows that movement of that hinge, movement of the spine. The lower back, the vertebrae of the lower back is lumbo. Okay. Your word root that means finger is dactyl. And then when you look at when you look at the bones of the hand, okay, we have the fingers, also known as phalanges, but you also have other areas. So the carpals here, carpo meaning wrist. This is where the hand attaches to the arm, to the radius and ulna. Okay, right here, radius is always thumb side. So you have multiple carpals, then you have your metacarpals and your phalanges. But for our instance, just know carpals means wrist, Then you have the ribs, all combining form costo. Okay, you have your true ribs, your false ribs, and your floating ribs here. So costals, the intercostal muscles here between um, the costals here. We'll be learning about those here shortly. And then moving on down the bones of the lower leg, your femur, okay, your thigh bone, and then your tibia, which is your shin bone. Then we have the descriptions of joints. So joints are where two bones come together. Okay, there's multiple bones within the body, and we've looked at that, and there's different types of joints. There again, that's an anatomy and physiology class. But just know that oftentimes in between bones or where bones come together, you may have what's called cartilage. Okay, cartilage is the kind of the material that helps to protect the bones and helps attach them together, and also acts as kind of um, a shock absorber in a way. So the combining form for cartilage is chondro. Okay, so chondrodynia, pain in the cartilage. Where two bones come together, that is called a joint, and the combining form for that is arthro. Also, within certain types of joints, such as your elbow and your knee, you'll have a fluid-filled sac that also aids in that lubrication of the joint, that movement of the joint, and that cushion effect of the joint to reduce friction and cushioning. And that's known as a bursa sac or burso. So bursitis, inflammation of that bursa sac, or a bursectomy or bursotomy, cutting into it or surgically removing it. So, in a very elementary terms, that is the skeletal system and the terms that you need to know for the skeletal system. But remember, this is musculoskeletal that we're learning about. So let's move on to muscles now. Okay, muscles attach to the skeletal system to perform movement. So it is thanks to these two systems working together and their accessory tissues that allow us to be able to move the way we do. So you're combining forms that mean muscle, musculo, myo, or myoso. Okay. So three different ones there: musculo, myo, myoso. Muscles attach to bone by way of tendons. Okay, a tendon is a type of connective tissue that attaches muscle to bone. Your combining forms of those are tendo, or tendino. So we have multiple ones of those as well. Is there a picture? Yeah. Don't really see. There's a tendon here. Okay, so a good example of a tendon would be, well, yeah, right here. Okay, where you see the muscle attaching to the distal end of the bone here. So tendon. When the two systems work together and motion happens, that the study of movement, or the combining form or word part that means movement, is kinesio. Okay, kinesio. You also, so kinesiology, the study of the body movement. This is an example here of the muscular system, and notice how on the left-hand side, these are superficial muscles, and on the right-hand side, you have deep muscles. The muscular layer, or the muscular system, excuse me, is in different layers. So it's almost like peeling back of an onion. So we're going to be studying some of these that may be superficial and some that may be deep. So that's why this picture looks a little different here. You see this top superficial layer, you see the middle layer, and then you see the deep underlying layer here. So multiple examples of that. When you go further into anatomy and physiology, if you do, you'll be studying those in painstaking detail. Here's a posterior view of those deep and superficial muscles as well. So let's go through and continue our study of some of the terms. We'll go back and look at some of these major muscles here in a minute. Tono is a muscle tone. Okay, how strong the muscle is, how easily malleable the muscle is. Okay. And then we talked about kinesiology, the study of movement. When we are putting movements together, that is known as coordination. So we take for granted that we can walk. We take for granted that we can chew and swallow our food. We take for granted that we can get up from a chair. Okay, that kind of thing. We can sit up, sit down, stand up, sit down in a chair. All of those are complicated, coordinated movements by our musculoskeletal system and our nervous system. And the study of that is kinesiology and putting those movements in order of which muscle does what movement is known as taxology here. And when something goes wrong with that, it can lead to ataxia or hypotaxia. Okay, meaning the study of the way a person moves, the debilitating way of think of physical therapists. They are studying each segment of a person's movement for a particular task. Okay, standing up from a chair. Okay, for instance, that is coordinated movement, arranged in a particular order, and the combining form for that and the study of that is taxo. Okay. Let's go back up here and look at some of the major anterior muscles first. Okay, you have deltoid. That term delta is Greek for triangle. You have your pectoralis major. Pectoro here means chest. Okay, biceps, bi meaning two, sep meaning head, brachii meaning branches. Okay, so those are your anterior flexor muscles of the arm. Trapezius and your pectoralis minors. Okay, so yeah, this is another good example here. Your textbook does not go into a whole lot of detail on how muscles are named, but you see superficial muscles here are usually the major ones. Notice how much larger this chest muscle, pectoralis major muscle, is compared to these pectoralis minor muscles, which are deep. Okay, you have your abdominis, you have your radialis, your femoris here. Doesn't look like you need to know those particular. When we look at the posterior muscles, this is a good example here of the trapezius. Looks like a trapezoid, okay, shape. That's why it got its name. You see your latissimus dorsi here, latissimi, whoops, what I did there, latissimus meaning large, dorsi meaning back or dorsal. Okay. External abdominal obliques. This is why I love medical terminology so much. I mean, they explain exactly where on the body. External, meaning it's a superficial muscle. Abdominal, meaning in the abdominal cavity or abdominal area. Oblique, meaning at an angle. Okay. The term tells you where it is, what it is. It's awesome. Okay, gastrocnemesis here, gastro meaning stomach. And the ancient Greeks thought that this looked like a stomach. So a well trimmed, a well toned gastroc, stomach of the leg. So, all right. So let's move on to patient history. So, what can go wrong with the musculoskeletal system? Don't forget to do your learning outcomes as always. What can go wrong with the musculoskeletal system? So, ostealgia, arthritis, myalgia, hypertrophy. What are some things that can go wrong? So, let's go through some of the common terms where there might be pain or issues with the musculoskeletal system. So costalgia, okay, pain in the rib cage or the pain in the rib cage area, whether it be muscle or bone. Ostealgia, bone pain. Osteodynia, also bone pain. Spondylodynia, vertebral pain. Tibialgia, pain in the tibia. And if you remember, that is the bone of the lower leg or your shin. Arthralgia, arthrodynia, all of these are different terms that mean pain of a joint. Okay. Can be elbow joint, can be knee joint, can be a phalangeal joint. Don't really know what joint yet, but we know that it's a painful joint. This one we do know where it's at because we know that cervico means neck. So cervicodynia, this is neck pain. Moving on to some of the muscles. We've had a lot of these prefixes back in chapter 1, so make sure you go back through and review those. Remember Brady, the prefix Brady means slow. So bradykinesia, slow movement, person who is walking slow, getting up from a seated position slow, moving slow, that's bradykinesia. Dyskinesia is bad movement. So it might not be slow, but it's uncontrollable. Okay, where dys means bad, painful, or difficult. So dyskinesia, the inability to control movement. Dystaxia, poor coordination. Dystonia, poor muscle tone. Okay, myalgia, muscle pain. Myasthenia, muscle weakness. Okay, notice how that suffix changes that whole term. And then tenalgia, pain in the tendons. All right. Learning outcomes. Make sure you go through those. And then let's see. Yep. Lastly, 4.3, observation and discovery. So some of the different types of diseases that affect the musculoskeletal system. Hopefully none of you have suffered from any of these. But they use imaging techniques to look inside the body. So you have computerized tomography, tomo meaning to slice, graphy meaning to record. Okay, so remember those word parts there, known as a CT. Computed axial tomography, there again, a CAT scan, and then magnetic resonance imaging, MRI. Range of motion, studying a person's ability to move a joint, okay, that mobility of a joint. All right, so let's just dive in here. So arthrocentesis. Okay, so arthro means joint. Centesis means to puncture, to remove fluid. Okay, arthrocentesis. You may be more familiar with an amniocentesis, okay, where a pregnant woman has her amniotic fluid removed to test for issues related to the pregnancy or health of the pregnancy. Amnio meaning the amniotic fluid. Here, we're removing the fluid from this internal bursa sac that we spoke about earlier. So arthrocentesis, to puncture, to remove fluid. We use an arthroscope to look into a joint, and arthroscopy, the procedure of looking or the actual looking at the joint. Okay, that procedure that lets us do that. Excuse me, sorry. I should have muted that. I'm so sorry. Then we have these radiology terms, an arthrogram, the visual recording, the picture, the static picture of the joint. And then we talked earlier about a CAT scan, computerized axial tomography. Okay, the axis or axial meaning pertaining to, tomo meaning to cut, graphy to record. When we're looking at the vertebral column and we have abnormal curvatures of the spine, depending on the curve of the spine and the direction of that curve and which vertebrae are involved determines the name. So this is one called kyphosis, known as humpback here or dowager's hump. Kypho meaning bent, and this affects these mainly the thoracic vertebrae. Okay, remember you have cervical here, thoracic here, lumbar here, sacral here. So notice how the major curve is here of the thoracic vertebrae. The next one here we have lordosis, okay, known as sway back or bent back, and this affects the lumbar vertebrae. So the way I remember it is L for lumbar, L for lordo. And then the next one here, scoliosis. This is the abnormal lateral curvature of the thoracic vertebrae. So crooked or bent. Scolio meaning crooked or bent. Okay. So, and also think of an S shape. You have this slight S shape here. Notice how one shoulder is shorter or angled down. Okay, see how here the patient's uh, left shoulder is lower than the right, and how the left hip is higher than the right. Okay, that's due to this abnormal curvature here. So scolio, S-shaped curve of the scoliosis, the lateral S-shaped curve of the thoracic vertebrae, lordosis, the inner curve of the lumbar vertebrae, and kyphosis, the abnormal curvature of the thoracic vertebrae in the bent condition. Okay, so not lateral, but more interior here. All right. And then let's look at the different types of bone fractures. All right. So I believe this is on page 86 of your textbook, and not that you need to know all of the different types of breaks. We will go over them here, but just know that a fracture is a bone break, and we'll be looking at some of the procedures to fix that under the treatment section, which will be the next video. Think back to, what was it, chapter 2, when we learned some of these planes. Remember the transverse plane, the oblique plane that we talked about when we were looking at dividing the body into anterior, posterior, or excuse me, anterior, dorsal, anterior, posterior, ventral, dorsal planes. That's where this one gets its name from, transverse meaning across. So this is a transverse fracture. Then you have an oblique. That term oblique means at an angle. Spiral fractures here usually happen when the bone is in motion, and you might be questioning, well, this looks like an oblique fracture, so what's the difference? Well, if you were to actually look at the pieces, if it was a better picture and we were to look at the pieces, you would see that a spiral fracture has pointy edges, and it's not as clean cut as an oblique fracture would be. Angulated, okay, also at an angle here. Displaced, and then angulated, displaced. Okay. You also have dislocation, which is where the joint is out of the socket. So osteodystrophy. Yeah. Poor bone development. This term trophy means development or nourishment. Okay. Spondylomalacia. This is bone softening, which is oftentimes due to a nutrient deficiency or Could be something wrong with the kidneys as far as calcium metabolism. Okay. And remember, tarso meaning ankle. Atrophy. This is an excellent example here of a muscle that is atrophied and a normal muscle. This term atrophy means underdevelopment. Okay, so you see how this muscle here, this bicep is very toned, and here we have an atrophied bicep. Okay. And this term lysis can mean separate or to lose. So myolysis meaning loss of muscle tissue. All right. And then we have our learning exercises for this particular section. So make sure you're going through those and going through them as usual. Rinse and repeat. It's how we're going to do well in this class. You guys are doing well. Continue doing strong. Email me if you have any questions or concerns.